On the Medical Watch for you this evening, measles protection.
With cases rising across the country, medical reporter Dina Baer has some advice.
About 90% of the U.S. population has gotten their 2-dose regimen to protect against measles, mumps, and rubella. But increasingly, the unvaccinated have been contracting the highly contagious, deadly disease. So what are the chances of measles making a wider impact? And more importantly, how can we protect ourselves?
I like to have people think about vaccines like an umbrella, okay? And the idea is an umbrella doesn't necessarily keep you from getting wet, but it keeps you from getting soaked.
Pediatric infectious disease specialist Dr. Ravi Javeri says without proper coverage, the storm clouds ahead have him worried.
We see periodic outbreaks of measles because it's a very highly contagious agent. And even modest drops in the amount of protection amongst communities can lead to outbreaks.
Decades of research has proven the MMR vaccine is 95% effective after the first dose. Experts now say it's more critical than ever to know protection level and potential threat.
More than 90% of parents are having their kids vaccinated on time with the appropriate doses by the time their kids enter kindergarten. And so I want to make sure we recognize them for the effort they're doing.
The measles vaccine comes in 2 doses, working in stages to combat a virus that can linger in the air for hours after an infected person coughs, sneezes, or even talks. The respiratory infection leads to fever, cough, inflamed eyes, mouth sores, and a skin rash.
We know with an agent like measles that's very contagious that 95% wasn't enough. And so that led to those outbreak of cases in the late 80s and 90s. And so we then instituted a second dose to try to make sure we covered the population well. So even that 5% that maybe didn't respond to the first dose was captured and covered with a second dose.
Eventually, for convenience, doctors and parents began giving the second dose to children at age 4.
It became much more practical and effective to move it to that pre-K vaccine visit 4 to 6 years.
But as measles spreads now, should parents be concerned if their child only got 1 shot?
You're definitely going to be protected partially, yes. So again, 1 dose is better than no doses, and 2 doses is better.
For those teenage to adulthood, the 2 doses are far in the rearview mirror. And since the virus is one of the most contagious, with 9 out of 10 people exposed to an infected person likely to get sick, doctors can see a situation where greater illness is in sight, even for the vaccinated.
You should talk to your doctor about making sure you have up-to-date vaccines with the current guidance, and we're erring on the side of extra doses.
That's why the MMR shot is so critical for children, to render the population with herd immunity. As for adult boosters,
we're not necessarily at risk, but I think that if you're close to an outbreak or potentially could be exposed if you work, let's say, in a healthcare setting, we err on the side of extra doses.
Rising vaccine hesitancy has health experts concerned about other illnesses as well, including chickenpox and potentially polio. Back to you.